So the treatment of breast cancer depends upon the stage of breast cancer and the type of breast cancer. So breast cancer can be divided into 4 stages. Stage 1 and stage 2 breast cancer, generally early stage breast cancer, where the tumor is limited only to the breast and may have gone to few lymph nodes in the axilla. When there is an ulcer in the breast or there are multiple lymph nodes in the axilla, then it becomes a stage 3 breast cancer, which is known as locally advanced breast cancer. And stage 4 breast cancer is when the cancer would have spread to other parts of the body. So the treatment depends upon the stage of breast cancer and the type of breast cancer, which is decided by the immunohistochemistry, which gives us the estrogen receptor status, progesterone receptor status, and the HER2/neu status. In general, the treatment for early breast cancer and locally advanced breast cancer is with a curative intent, and the treatment involves a combination of surgery, chemotherapy, and radiotherapy, with or without hormone therapy and targeted therapy. And the treatment for metastatic breast cancer or stage 4 breast cancer is mainly chemotherapy or targeted therapy or hormone therapy based on the receptor status. So when we talk about the type of breast cancer, so I already told you, based on the hormone receptor status and HER2/neu status, we are going to divide breast cancers into 3 categories. The hormone receptor positive breast cancers, which are hormone receptor positive and HER2/neu negative. For these tumors, in early breast cancer, the treatment will entail surgery followed by chemotherapy plus or minus radiation therapy and hormone therapy. And the treatment for locally advanced breast cancer in hormone receptor breast cancers is usually chemotherapy followed by surgery, then followed by radiation therapy and hormone therapy. When we talk about triple negative breast cancer, wherein all the 3 receptors are negative, the usual treatment for either early breast cancer or locally advanced breast cancer is to start with chemotherapy followed by surgery and then radiation therapy. Only in very early breast cancer in triple negative setting, sometimes we could consider direct surgery also before giving chemotherapy. When we talk about HER2/neu positive cancers, again in early breast cancers or locally advanced breast cancer, we generally would want to give neoadjuvant chemotherapy in combination with targeted therapy before doing surgery, and after surgery, radiation may or may not be required. Surgery has a very limited role in metastatic breast cancer. Only when there is a fungating or a bleeding tumor, then we would consider surgery in metastatic breast cancers.